Wee woo, wee woo.
Pneumonia. Let's start antibiotics.
Are you sure that's the right diagnosis?
Well, I don't know. I'm only an intern. Here's an idea. Why don't you go spend 4 years in med school and then let me know if it's the right diagnosis? She's short of breath. She's got fever. She's post-op. Start the antibiotics. God, I hate nurses. I'm Alex. I'm with Jeremy. You're with the Nazi, right?
She may not have pneumonia, you know. She could be splinting or have a PE.
Like I said, I hate nurses.
What did you just say? Did you just call me a nurse?
Well, if the white cap fits.
It's a trainer. It's a dietitian. No, it's a nurse. That's right, folks. Nurses play a large part in health promotion for not only their patients, but also the communities they are involved in. Hey, I'm Zoe, a first-year nurse here at Western University. I'm here to talk to you about the health promotion. When thinking about health promotion, you're probably thinking about this. Well, that's where you're wrong. Health promotion is not only encouraging exercise, but actually helping to educate and promote a healthy lifestyle in general. In a book called Health Promotion Throughout the Lifespan, it highlights the importance of nurses in the process of community health promotion. It explains that there is an emphasis on nurses moving out of the traditional hospital role and into the community role. In non-traditional healthcare settings, nurses' role in their communities have actually played a large role in promoting healthy lifestyle choices and educating the public on making safer and healthier choices in their life. It is the upstream approach to nursing. It is understanding the reasons why patients experience problems, understanding those problems, and creating a solution for them, not just helping that one patient. You guys know the law about being mandatory for children to wear bike helmets? That was actually pushed by nurses. We're more than just those pretty faces you see on the TV assisting the doctors. We care about all of you, and we'll stop at nothing to make sure you are all educated on your health and safety.
Embedded in every nurse is the desire to help others. Elaine Bramhall states that the use of empathy is crucial to the role of nursing. It is a skill that differs from sympathy, as sympathy is feeling sorry for someone or pitying their situation. Empathy is an understanding of their situation, and that is why it is an effective skill used by nursing to communicate with their patients. There is natural and clinical empathy, and luckily for nurses, clinical empathy can be learned. Clinical empathy is used by nurses to demonstrate active listening and should be used by nurses when patients, clients, or even colleagues are hurting, confused, troubled, anxious, alienated, terrified, doubtful, or uncertain. The 3 stages of empathy are self-transposition, which is grasping the experience of the other individual through an interview process. 2, crossing over, which is putting yourself in their shoes. And 3, getting their self back, which is bringing yourself back to your perspective and using the knowledge you've gathered from crossing over and your own self-knowledge to help the patient. By using empathetic understanding, nurses can create successful therapeutic relationships and provide the best care for their patients.
Compassion is a factor that is necessary to be able to relate to the patient and know how to care for them from their point of view. Compassion is difficult to define, but in the Journal of Clinical Nursing, Chochinov defines compassion as, quote, a deep awareness of the suffering of another, coupled with the wish to relieve it, end quote. In the nursing practice, this would be seen as the nurse being able to understand what the patient is going through, whether that is having personally experienced the same problems or have previously helped patients going through the same thing. The issue with this topic is the way that nurses present compassion, as they often get it mixed up with sympathy. Compassion is not simply about wanting to relieve the patient's suffering, but is about allowing the patient to keep their independence and dignity while the nurse is able to enter the patient's experience. Because of this, patients assume that nurses are only there to make them feel better so that they can be discharged, rather than putting in the effort to understand the patient's pain and suffering and creating a care plan that is unique to that one patient. This is why compassion is a necessary component to the nursing practice, as it adds a personal factor that allows the client to feel welcomed and truly cared for instead of just being another patient in the care setting.
Effective verbal and nonverbal communication skills of the nurse is critical to providing high-quality care. The College of Nursing of Ontario's standard regarding therapeutic communication states nurses use a wide range of effective communication strategies and interpersonal skills to appropriately establish, maintain, reestablish, and terminate the nurse-client relationship. Communication skills are applied in every element of nursing. For example, nurses convey complicated treatment and therapy plans and provide education to promote the client's health. Healthcare professionals tend to focus on the client's illness rather than the client as a human being. A major role of the nurse is to communicate information that may be complicated for the client and their families to understand to ensure patient-centered care. Clients are given the opportunity to express their perspectives and beliefs with the nurse, who then shares such information with the rest of the healthcare team. Effective communication allows clients to feel at ease, in control, and heard within the complex healthcare system.
One of the core values of nursing is advocacy. The American Nurses Association identifies advocacy for safe, effective practice environments as a responsibility of the professional nurse. They say that nursing advocacy is embedded in nursing management, education, clinical practice, and policymaking. Although advocacy surrounds all aspects of professional nursing, you can define it in 5 types: legal, moral ethical, political, spiritual, and substitutive. Legal advocacy means a nurse protects patients' rights to proper care, refused care, informed consent, and to privacy. Moral ethical advocacy means that nurses make sure that the patient's values and beliefs are upheld in all decisions. Next, advocating politically means to ensure equal access to health care. Similarly, advocating spiritually means ensuring spiritual support and reassurance is accessible. And lastly, substitutive advocacy means a nurse will protect the interests and give a voice to those who are incapable of speaking for themselves. So, we can see how advocacy is intertwined in all aspects of nursing. Without advocacy, a patient may not receive the care they truly want and they truly deserve. Let me give you an example where advocacy in all its 5 dimensions comes into play. A patient in palliative care asks the nurse about assisted dying. Now let's see how she can use all 5 dimensions of advocacy to give this patient proper care. First, she uses legal advocacy to provide this patient with proper information on all end-of-life care treatments. These kinds of treatments can be controversial to some, and thus, the nurse ensures that whatever decision is made, the patient's values are being respected, using moral ethical advocacy. The patient decides she wishes to proceed with medical assistance in dying. The nurse then spiritually advocates for her by providing access to spiritual resources. Let's say the patient meets the eligibility criteria for this procedure. The nurse will politically advocate by making this care available to her. And lastly, she can demonstrate substitutive advocacy by being supportive of the patient's interests.
This is the end of our public service announcement, but please remember, a nurse's role is dynamic. We have only highlighted a few attributes that make up a good nurse, but each of these different points we touched on today are important to us. We are able to use our understanding of the past year of school and what we believed was a significant part of being a nurse and give examples of each to help make the world aware about the importance of the nursing practice and what real nurses do, not just the portrayals in the media.
1, listen to the nurses, respect the nurses, do whatever the nurses say. You may think you know more than the nurses, you do not.
We're first-year nursing students and we approve this message.